Alright, so we've recommended that you run a blood test. So it's either going to be a genie test, proteomics, or a combination of the two. We'll speak with you directly, explain the pros and cons of each options for testing, and then we'll make some recommendations as to preferred testing methodologies. After that, we'll arrange blood draw. If we need to ship the lab test to you, we'll of course do that, and then arrange blood draw. And then we wait generally 4 weeks to receive test results. And so in your next appointment at the clinic, we would do what is called a lab review. So we're going to do a deep dive into the test results of your proteomics. And for those of you who aren't familiar, when I say proteomics, what we're meaning by that is your MMP9s, your TGF-beta 1s, C3A, C4A, MSH, standard suite of CIRS labs. So we'll review each of those markers, discuss reference ranges, what was used when Richie or Dr. Shoemaker initially established CIRS. So we'll use those reference ranges as opposed to what's going to be posted on your LabCorp or on your Quest reports. And then if it's Genie, we're going to do a deep dive into all the different systems of your mitochondria that are affected by this illness, and explain what each of these genes means and how different groupings of genes can point in the direction of actinomycetes or endotoxins or beta-glucans or mycotoxins. So at the end of that particular appointment, you're going to have a really great idea of just what's going on. Do you have CIRS? How is CIRS manifesting in you? And then we're going to make a recommendation to go ahead with what's called program reviews, where we would discuss what does your treatment plan potentially look like. So we reviewed your lab results. You've decided that, yes, this is the clinic you'd like to work with, and we're going to onboard you. We're going to do, the first thing we're going to do is a new patient exam. So we're going to spend an entire hour together doing a very, 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 very detailed health history. And at the same appointment, when we're doing a very detailed history of you, we also are going to want to do a very detailed history of your home. We want to know as much as we possibly can about this house of yours, like past water intrusion events, what year was it built, what type of foundation does it have. Pictures of the house would be great. We want to see, like, are there plants that are perhaps lovely but sitting right next to the foundation, so then there's the potential for water penetrations there. Do we see the surrounding landscape? Are there hills that are perhaps sloping towards your house? Is the grading of your house all going to be away from the house? Many different parts of the home we want to have as good of an idea as we possibly can, generally without ever seeing the home in person, and do as detailed of a history on your house as we are on you, because as you know, the first step of the Shoemaker protocol is removal from exposure. So if the house is going to be a concern, we're going to want to know how we're going to want to properly test it. So again, on the topic of testing your home, we're going to want to know, is it a bungalow? Is it a split level? Is it a 2-story? So we can start to figure out how are we going to best test and which biotoxins are we going to test for. A lot of times we're going to test floor by floor, so basement, main floor, upstairs. So if we do find anomalous results, we can have an idea of how to best kind of direct our investigation for potential sources of water damage. So that's what we do in the very first hour-long appointment. And after that, what we'll do is we're going to schedule you with our CIRS coach, Sheena, and we're going to see her probably on a weekly, if not twice a week basis for the first 1 to 3 months of care. And we do this because in that first hour-long appointment, myself or Jane is going to make some recommendations of we're going to start you on binders, or we're going to start you on here's how we're going to do your home testing. But that's a ton of information to absorb and download in an hour's time. So what you're going to inevitably need is a lot of hand-holding throughout this process. So Sheena is going to be there every step of the way, meeting with you. As I said, 1 to 2 times per week, like a lot in the beginning. She will show you how to collect dust, where to collect the dust, how to ship your home test. All of this is incredibly hard to figure out on your own, especially if you're dealing with a savage amount of brain fog like the average person with CIRS is. So what we like to do is just have you pass that load on to us at the clinic. We will hold all of that stress of figuring out all the logistics and the shipping and all of that. We've figured it out. We know what to do. We know what codes to put with shipping carriers, etc. So in your meetings with Sheena, you'll go through all those logistical steps that are so time consuming, so challenging, and when your resources are stretched so thin, it's really nice to just have that extra layer of care to have somebody else handle all of the logistics of everything. We'll, of course, go through all the supplements that need to be shipped, the binders that we're going to use, etc. in that first appointment. But that's kind of the gist of what we'll be doing.